He specialized in internal medicine, pulmonary and critical care medicine and is also American board certified in these fields. He has also obtained a master's in public health degree. Dr. Sai Praveen is also a fellow of the American College of Chest Physicians and with the International Hospital Federation. He is also active in beside care in pulmonary and critical care medicine. He established the Apollo Lamb Clinic through the Lamb Foundation to bring world-class care to the region for this rare disease. Welcome, Doctor, to our Facebook Live.
Thank you, Jasmine. Hi.
So, starting with our questions. So, Doctor, what do you have to say on this year's World COPD Day theme?
So, I think, as you know, COPD is a chronic obstructive lung disease or chronic obstructive pulmonary disease. Thank you for the introduction. And essentially, what happens with COPD is you get lung damage, and every year the Gold COPD program and the World COPD organizations have been celebrating mainly the advances and reminding people what COPD is all about and how can we actually try to control it and diagnose it. This year's theme is Your Lungs for Life, and which is a true statement, because when you're a child, your lungs are small. As you start growing up, the lungs get bigger, but your lung size is determined by your height. So taller people have bigger lungs, men have little bigger lungs than women, and when you reach the age of about 12 years or so, your lungs are actually at a maximal size. After that, the lung capacity can start declining a little bit every year for everybody. They estimate that it goes down by about 15 to 30 ml. That's about 2 teaspoons or 3 teaspoons, in that range of ml per year you lose lung capacity. And with time, this will kind of taper down and your lung capacity will decrease as you get older. Now the thing is that your lungs are there for life, and the lungs don't regenerate like many other organs. The liver may regenerate. There is some data suggesting lung might, but it's not definite that the lungs don't increase in size once they are damaged. And the way to handle damaged lungs is to control the symptoms as well as do things which will help you function in life with a lower lung capacity. The analogy I like to give is having a big car with a small engine or a small car with a big engine. Essentially, you need to control the way you operate these vehicles, mainly because your engine capacity has to match what your body requires. Likewise, if your lungs are decreasing in size due to age or due to disease, you may need to match how you use your energy so that you have enough oxygen and you blow off the carbon dioxide. So your lungs are with you for life. Your lung capacity does decrease with age, but you can maximize the power of your lungs by making sure that you're doing healthy things and also avoiding unhealthy things, which we'll talk about.
So, Doctor, basically what is COPD?
So COPD is chronic obstructive pulmonary disease. So if you take the human lung and you stretched it out completely, it will be about the size of a tennis court, really big. And this entire surface area of this lung or tennis court is to exchange oxygen and carbon dioxide. So when you breathe in the air, the oxygen goes in, and the air has about 21% oxygen at sea level. If you're in an aeroplane or on top of a mountain, obviously the oxygen level is less, but that oxygen goes into your lungs, gets absorbed, and your body through metabolic process generates carbon dioxide by working on the food that you eat, the energy that you expend when you're exercising. All of that carbon dioxide gets blown out. So oxygen comes in, carbon dioxide goes out. Now plants and trees, as you know, do it the reverse way, right? The photosynthesis. So for human beings, we get the oxygen in and blow the carbon dioxide out. And in COPD, what happens is, because the surface area of the lung is damaged. Now this can be because of, I'm sure you'll want to know what are the causes of damage. It can be from smoking. It can be due to what we call biomass burning, like people who are using chula in the house or wood fire, that exposure. Second-hand tobacco exposure, certain dusts that you're exposed to, air pollution, all of these things can damage the lung. When they damage the lung, not just the lung surface itself, but the pipes can also get damaged. So going back to anatomy again, the human lung is, you have the trachea, the middle, the windpipe. It splits into two, on the left and the right. Then it keeps splitting another smaller tubes, about 23 generations, so 23 times it splits, and then you get these grape-like things which are called the alveoli. The alveoli is where the gas exchange happens, oxygen coming in, carbon dioxide going out. In COPD, you can have a problem with the alveoli, you can have smoke cough, and that's because normally the lung does produce a little bit of mucus, but if you are a smoker or exposed to a lot of dust or sometimes allergies too, you generate more mucus, and that mucus can block off these tubes. As you know, if you block off a tube, you may not be able to get enough oxygen in or blow the carbon dioxide out. So I think it's important to realize that your actual lung capacity is determined not just by your own lung size, but the tubes matter, and also you can have issues with environmental things, like if you have a lot of allergy in the environment or dust in the environment, that can also cause difficulty with breathing.
So doctor, usually what are the symptoms of COPD?
So one of the things I like to tell myself and remind patients also is, when you can't breathe, nothing else matters. So in COPD, you can get to a situation where your lungs are affected so much that you're unable to breathe. And that happens because these tubes we talked about, they can close off and get narrow. But unlike in conditions like asthma, where the tube gets narrow but then it relaxes after some time, in COPD, if there's something triggering, it's very difficult for the tubes to reverse. And sometimes the tubes don't change in shape, so you don't get enough air going in and out. Also, you can have difficulty with mucus production. You can produce a lot of phlegm, and the phlegm can lead you to a cough. And if you have a cough with mucus, with the narrowing of the tubes, you can have wheezing sounds. You can also have shortness of breath because you're not able to get enough air. And if the shortness of breath gets severe enough, you might get sleepy because the carbon dioxide level goes up because you're not able to push out the carbon dioxide. And you can also end up with situations where the heart gets affected because of the high pressure that the heart has to pump against the damaged lungs. That can of course lead to even more damage, causing leg swelling. You can have something called blueness in the face when the oxygen goes down. Now the body has a way of fixing problems. So when the oxygen goes down, what happens is you increase the number of red blood cells and you can increase the hemoglobin in the body. So smokers often have a little higher hemoglobin, and that can also lead to people looking very flushed and red even with COPD. If you have COPD, you may have difficulty with walking because you get short of breath. You can also have a situation where if you go at a little altitude, you get more short of breath than others. Some rarer problems can also happen, including things like blood clots, and also sometimes you can have lung collapse. You can have holes in the lung which get bigger, and these are all things which we as pulmonologists and physicians often see. You can very rarely, of course, end up with more complex problems happening because a lot of people with COPD have other medical issues too. So you can have heart issues also, and when you smoke, you're also causing high cholesterol. You can have heart attacks, and you can also have lung cancer. So these are some of the associations people with COPD have, and a lot of people with COPD are using their energy just to breathe, and they lose muscle because all of the energy is going off for breathing and they're not able to build muscle. So this is just a quick summary of all the things that can go wrong when you have COPD.
So doctor, what is natural lung growth and the effect of tobacco?
So we talked about what happens to the human lung, right? We talked about the tennis court size. There are several million what we call alveoli, those structures which are important in exchanging gases. The normal lung, as I said, grows up to 12 years of age and then slowly declines. People who smoke lose their lung capacity much faster. So tobacco exposure can lead you to lose even 100 ml per year. So as you know, if the lungs normally are about 2 liters lung capacity, if you lose 100 ml a year, very quickly you're going to feel short of breath. Tobacco has that effect where it also increases the inflammation in the air tubes, and because the inflammation goes up, you get mucus production and the tube gets narrower. Imagine a circle is a cut section of the tube. You have a little mucus lining, normal. But if you smoke, what happens is this mucus builds up and the tube gets narrower and it becomes really small. I'm sure all of you like to use a straw to drink a juice, for example, or sometimes you have these thick shakes where you need a big straw. So a big straw is obviously easier to get air in. A narrower straw is more difficult because there's more resistance. And same thing happens in lung problems where the tubes get narrower and you end up with difficulty with the mucus getting plugged up and the air not going back and forth.
So doctor, are there any effect of air pollution on COPD?
Absolutely, Jasmine, because see, what happens with air pollution is you have a lot of chemicals like sulfites, I think nitrites. So many of these chemicals are irritants for the lung. Along with the dust, they can narrow the tubes, they can cause inflammation of the tubes, and you can end up with a similar situation as a smoker. And you can end up with a lot of damage inside the lung, not just from the actual dust, but you can also have what is called oxidative damage, where something called free radicals, they can damage the lung structure, and you can end up with not just wheezing, but you also end up with narrowing of the tubes and mucus production and infections also.
Are there any other medical problems on COPD?
See, like, lung effects in COPD can be related to not just the actual tubes as well as the mucus, but it can also be related to things where the diaphragm can get flat. So imagine the lung is a big balloon, and the diaphragm is that muscle that separates the chest and the abdomen cavity. As the lung gets damaged and the tubes start kind of getting compressed because there is nothing to hold them open. So just going back, imagine this bunch of grapes and the tubes coming out. These grapes are actually pulling the air tubes open. In COPD, the damage causes these lung small units to actually break down. And if they break down, they're not able to hold the tube open and the tube closes. So the air can go in, but it can't come out. And if that were to happen, you end up with a situation where the lung gets bloated and the diaphragm gets pushed. So you might have an increase in the chest size, and that's something that can happen. So along with wheezing, diaphragm problems, muscle weakness, mucus blockage, as well as tubes that don't relax easily, you can have a lot of issues with COPD. And because of this, your oxygen level can go down and your carbon dioxide level can go up.
So doctor, what is the role of oxygen?
So see, normally when we breathe, as you know, on room, like, when you're at the sea level, your oxygen is 21% is oxygen. As you ascend, it keeps coming down. But if you end up with COPD, you may not have enough oxygen even at sea level. You're not able to get enough oxygen into your lungs. And then your heart has to work harder because it has to pump the blood everywhere to deliver oxygen. So your heart rate may go up. Because of that, your blood pressure may have fluctuations. And because the carbon dioxide level keeps going up because it's not coming out, that can also affect the heart. It can also make you more sleepy and drowsy when it goes up too much. So your oxygen and carbon dioxide balance is affected in COPD, and you may need oxygen from outside to help with COPD. So we've been talking about COPD. We talked about the normal human lung. We talked about the normal human lung anatomy. We have talked about the damage that can happen with tobacco. We also talked about how the lung shape and size maximizes in childhood and then slowly decreases. When you smoke, the lung capacity goes down even more. Now, all of this sounds very bleak, but the reality is it's in your hands to control a lot of this. Obviously, avoiding dust, getting your lungs more fit by doing more exercises, as well as building your muscle to help the lungs work better, because the lungs are surrounded by many muscles which work with the rib cage and the diaphragm and the neck muscles to help you breathe. But the most important is probably to avoid tobacco, avoid smoking, because tobacco use is the number one cause of COPD. It is also the number one cause of lung cancer. So it's very important to try your best to avoid damaging the lungs, and I think you can make a positive difference by trying to quit tobacco.
So doctor, is there any role of a flare-up on COPD?
Yeah, so when people have COPD, most people do okay. They are kind of managing. In fact, most people with COPD don't know they have COPD. So COPD can be one type called chronic bronchitis, another one called emphysema, where the lungs are kind of filled with holes. In bronchitis, you get more mucus. Now, in both of these, you have multiple ways you can kind of treat somebody, and you can use medicines to relax the tubes. You can use antibiotics when they need it. Sometimes you need steroids. They may be inhaled steroids or oral steroids to control the flare-up. And when the flare-up happens, people get very short of breath and they can almost pass out or collapse. And many people may end up in a situation where they need to be in a hospital. They may need a machine called a non-invasive ventilator to help them breathe. They may need to be even on a complete mechanical ventilator with an endotracheal tube that goes from the mouth to the throat into the lungs. So they might even need that. And it's important to realize that these are serious situations, but if it is caught early and treated well, you can prevent these exacerbations. vaccines like influenza vaccine and pneumonia vaccine might also be able to control, prevent exacerbations due to these infections. Allergies can also coexist, and you can have other medical issues including diabetes, tuberculosis, and these need to also be controlled in COPD. There's also a condition where you can have asthma and COPD overlap. You might have both conditions, and you can also have with age scarring of the lung which happens, and you can have scarring and COPD. So multiple combinations are there. Now there are fortunately many treatments out there. The treatments are aiming to relax the tubes, thin the mucus. The relaxation of the tubes can be from decreasing the inflammation. It can also be due to relaxing the actual muscles coating the tubes, and they can be short acting or long acting, and these can be inhalers, dry powders. You may need to use a spacer, you might need to use a nebulizer. You are also having tablets which relax the tubes, and now we are getting newer treatments out there even for COPD.
So doctor, what medicine or inhalers or nebulizers are available for the treatment?
So like I just mentioned, you do have medicines which are called beta agonists, and you also have inhaled steroids. So these are medicines which relax the tubes. You also have anti-inflammatory other kinds of medicines you can use in COPD, and now we have various versions of medicines which even can be taken just once a day, for example, and we also have medicines which work on the inflammation pathway to block it off, which are not always steroids which cut down the inflammation completely, but you have other medicines which can work on other pathways of the inflammation. There is a lot of research going on into testing newer treatments for COPD, and I'm not sure you're going to ask me this, but there are surgical ways of even managing COPD. These include actually removing a part of a lung that doesn't work. Now we even have something called endobronchial valves. So you go in with an endoscope like a bronchoscope, go in and block off some parts of the lung which are not working. So they are like one-way valves, and there are newer ways of research where the people are looking at whether stem cells can help. People are even experimenting with growing new lung, but these are all in the very experimental phase, and newer types of treatments for COPD using medicines are still coming up.
Doctor, are there any surgeries required for COPD?
So you don't always need to operate, but there are situations where if there is a part of lung that is not working, you may have to remove it. The concept is that when you breathe in, the oxygen that you breathe in goes everywhere. It even goes to part of the lung which doesn't work. So one of the concepts of lung volume reduction surgery is where you cut off the part of the lung which is not working. So that way the oxygen doesn't get wasted to the lung that is not working, and it gets diverted to the part that is actually working.
So coming towards our audience question, so doctor, is COPD curable?
So really speaking, it isn't, but it can be very well controlled with medicines and avoiding the triggers like tobacco and dust and air pollution. And with sometimes you need medicine to control it. There are people who have even run marathons and participated in Olympics with COPD. So it's not like it's something you can't do anything about. But with age, you may end up needing oxygen from outside, and you may need very rarely a lung transplantation to change the lungs if they're totally destroyed. Now, the unfortunate reality is there's not enough lungs to treat everybody who needs a lung transplant. So prevention is absolutely better than trying to even go in for advanced treatments.
So doctor, are there any dietary habits that needs to be followed?
So really speaking, there's no specific thing, but as I mentioned earlier in the discussion, you can end up with muscle loss. You may need to make sure that your diet has adequate protein. You also want to check and make sure that you're not taking something that you're allergic to. And there are situations where you may need to use medicines or even dietary changes to avoid excessive bloating in the stomach, especially if your diaphragm is tending to go up. So there are some subtle things you can do. You should also prevent acid reflux, because acidity can damage the lungs, and that's something you should look at.
So doctor, can people with COPD go outside?
Absolutely. I mean, you should be able to do everything that anybody else does, including swimming. You can even go in a plane, but with your doctor's permission, especially if you have a lot of what we call bulla in the lung, which are little holes in the lung, because as you ascend in an airplane and the pressure comes down, these things can enlarge. You should also be aware that sometimes people are exposed to various infections. As you saw in the COVID pandemic, people are exposed to multiple infections. So you want to try to avoid infection by wearing a mask, washing your hands, and of course checking for other medical issues like diabetes and tuberculosis. Those should get well controlled, and heart problems and lung cancer should also be checked for.
So doctor, what makes COPD progress faster?
So if you smoke, it will get worse. If your diabetes is out of control, COPD will get worse. If you have issues with mucus plugging and the mucus is not cleared out, you have a lot of allergies, or you're not taking your medicines the correct way, that can make the COPD progress. Each flare-up of COPD will decrease your lung capacity a little bit. So it's important to try and treat a flare-up, or what we call a COPD exacerbation, very quickly.
So doctor, is COPD fully reversible?
So like we talked about, it's not curable, but the symptoms are fully reversible. You can live a completely normal life with COPD as long as you take the right medicines and talk to your doctor about the latest advances, because there are multiple simpler ways of taking medicines now.
So are there any latest advances in the treatment of COPD?
So we've run down some of these earlier. So some of these include things like newer surgical options. There are of course newer types of medicines, including inhalers, nebulizers and tablets that are available. They are talking about gene therapy, stem cell therapy, but they're very experimental at this stage. There are devices you can use to help you with your oxygen consumption, and when the oxygen is given from outside, sometimes you don't need it all the time. People with COPD might also have sleep disorders, and sometimes they may need a machine called a CPAP machine to use at night, or a BiPAP machine, which is a form of bi-level airway support to help the lungs stay open. There are many exercises people with COPD can do, and these are some of the recent advances. And as research progresses, especially in countries like India, where we have a very large number of COPD patients, several million of them, and many of them, more than 500,000 die every year. So it's important for us to recognize that even newer treatments are required for COPD.
So doctor, what is your final message to our audience about COPD?
I think it's important to recognize that your lungs are for your life. Your lungs grow with you, they will age with you. You have to take care of your lungs like you take care of every other part of your body. You need to obviously exercise, eat healthy, make sure that you're avoiding dust, avoiding tobacco, avoiding second-hand tobacco, and getting regular checkups with evaluation of your lung capacity, and according to your doctor's advice, any form of imaging that may be required to check your lungs. You may need to do something called a pulmonary function test. A lot of people do a spirometry and can get picked up for COPD, because a lot of COPD can be subclinical, meaning nobody knows they have it until much later. But if you actually do a pulmonary function test or a spirometry test, you can pick it up much earlier. So I would suggest you, number one, avoid tobacco. People who are smokers or chew tobacco or are using BDs, counsel them and talk to them and get them to a doctor to avoid lung damage. And if somebody does have a COPD diagnosis, take them to a health facility that can handle it in a comprehensive manner.
So coming towards the last question, so doctor, could you please tell our audience about the facilities provided at Apollo Hospital, Jubilee Hills, Hyderabad?
So we are at Jubilee Hills, Hyderabad, and it's a multi-specialty hospital. And what that really means is that people with COPD who sometimes need to see a cardiologist, they need to see pulmonologists, they may need to see an endocrinologist or a diabetes specialist, and general medicine doctors to kind of put everything together and have radiology services, cardiology services. All of these are available in one place. So typically for a COPD patient, we would do a lung function test, we would get a chest x-ray, sometimes do an HRCT or a screening CT scan of the chest to look for any damage from previous tobacco use. Also get the sputum or the phlegm tested for infection, check the blood for any allergies, and also of course do specialized testing, including checking the oxygen level and even some advanced tests like arterial blood gas to measure the carbon dioxide level. So these are the basic tests that are required for somebody with COPD to get an assessment of where they are. We also have a lung rehabilitation program where we can train somebody who already has COPD to learn to live their life better, kind of figure out a way to learn to use their lungs better. So when you can't breathe, nothing else matters, but there is a facility available to control your symptoms and get back to your own good quality of life.
So dear viewers, we have come to the end of our session and hope we have covered all aspects. If you still have more doubts, you can book an appointment with Dr. Sai Praveen Haranath and clarify your doubts. Thank you, doctor, for educating our audience in today's session.
Absolutely. So thank you again for this opportunity, and we do have a pulmonology team here. Several of my colleagues are available to help you with your lung issues. Good day.
Thank you for joining us. Stay tuned for more such educative live sessions. Namaste.